Good morning, America, and welcome to Going on Offense. Thank you for being with us, and we look forward to you joining our conversation. We have a wonderful guest panelists today, and we'll be talking about health insurance and employee well-being. Now, we're holding these huddles every Monday, Wednesday, and Friday in an effort to be supportive to those who are struggling, to brainstorm strategies to help, to promote resources, and to engage collaboration. Now, to introduce today's guest. It's my pleasure to introduce my friend, Jim Purcell, founder of Returns on Wellbeing Institute, former CEO of Blue Cross Blue Shield of Rhode Island, and healthcare public speaker. I'm going to invite Jim to take 4 or 5 minutes to introduce himself and share a comment or two about today's topic. But before I do, I'd like to invite you, our attendees and participants, to join the conversation. Feel free to, anytime during the huddle, raise your hand. I'll turn on your microphone. You can join the conversation, ask questions. We can hear from you. Or if you'd like to just send in a question, you can, again, use the control box, send in your question. I'll read it out loud and we can address it. Jim, would you like to introduce yourself?
Well, thank you. It's nice to be here, Daryl. Thank you very much. For many years, I was a trial lawyer, mostly in healthcare. And in the course of my representation, I did a lot of representation of Blue Cross Blue Shield of Rhode Island. And I handled every one of their rate hearings from the mid-'80s until 2000, when I decided to become the Chief Operating Officer of Blue Cross. And I did so because I could see the rest of my life being the managing partner of my law firm, but healthcare is probably the second biggest mess in the world other than the Middle East. And I thought if I got involved there, it would really be interesting, and it was. I became the Chief Operating Officer of Blue Cross in 2000. I stopped practicing law. I immersed myself in the business. Everybody there reported to me. I reported to the CEO. 2004, my CEO got into trouble. He got fired. After a national search, I became CEO until 2012. It was interesting. We can talk about it a little bit, but I think today is much more about health insurance itself, as well as employee well-being. When I retired, I sometimes called it escaped, but when I retired, I thought I'd write and speak about healthcare delivery reform. And I had healthcare delivery reform down to 4 sentences, but everyone was agreeing and it wasn't getting done, and I was getting frustrated and bored. And I thought about the other half of the equation, which is, even if we had the very best delivery system, if people lead increasingly unhealthy lifestyles and become increasingly chronically ill, nothing's going to help. And why is this happening? Because that for sure is happening. That led me to workplace wellness and workplace well-being, which I thought, why isn't that the best starting place? We have 150 million Americans going to work every day. We have a delivery system, a communication system, and we have employers that, for better or worse, are funding health insurance. They have, skin in the game. And I found, to my dismay, that 90% of the wellness or well-being programs that were being conducted in the US were pretty much failures. They weren't making people healthier, more productive, more engaged. They weren't reducing turnover, and they for sure weren't reducing healthcare costs. So with the help of my co-founder, Steve Van Yoder, we formed the Returns on Wellbeing Institute. The idea being, even though we're small and we're a startup yet, we're about a year old, we are trying to not only have content, trusted content, but deliver best practices, terrific speakers, writers, and help employers create workplaces that focus on employee well-being. And this is not so much about the programs. Certainly, Orion and Daryl know very much about this. It is first about convincing CEOs, boards of directors, and the leaders of organizations to create workplace cultures of well-being that are ultimately supportive of focused programs that then would be put into place. Gallup tells us that the participation rates in programs in the United States in wellness programs is south of 30%, and a lot of that is lukewarm because it's driven by incentives or penalties. Not the way to do it. So what Returns on Wellbeing Institute is dedicated to doing is bringing the word and making leaders of organizations understand that this is not only the right moral, ethical, socially responsible thing to do for employees, but is also a really good bottom line business. It will boost top of the line revenue as opposed to being a cost cutting measure. So we are hoping to be a little bit of a part of a national movement to make workplaces better for employees and thereby better for employers.
Well, and Jim, you and I have had a lot of conversations about that, but maybe you'll take a few more minutes and talk about your focus on the board, because I think you're one of the few people in the country that really addresses the board of directors, the owners of companies, and saying, look, fiduciarily, that's the right word, focusing as a major strategic objective of your organization that you as a board follow up on should be the well-being of the workforce. Talk a little bit about that.
Okay. Some of you out there may be on boards. I've been on a lot, and I've been as guilty as a board member as anybody else has in my time before I got religion on this. But what board of directors has ever held its CEO accountable for the health and well-being of its employees? Almost none. What board of directors has ever even discussed the health and well-being of its employees other than to gripe about health insurance costs and also try to force the CEO to increase employee shares of health insurance? They haven't done that. I have come up with two reasons why that is so. One is that boards are mindful of the division line between providing strategic oversight and holding the CEO accountable and letting the CEO be in the weeds and do the managerial, the management prerogative. But to say that employee well-being is not strategic is to put their heads in the sand. There is probably nothing that is more important when a board would think about it than employee well-being and engagement. Because how do organizations get things done? They get things done through their employees. And it's fundamentally understandable that if you have engaged, productive, enthusiastic, loyal employees, whatever you do is going to get done better. So the fact that boards of directors do not go here is stunning. The second reason why they don't do it is they don't think about it. And my job is to bring that message and say, please think about this. It's strategic, it's important, you have a role, and to fail in that role, is it a breach of fiduciary duty? I'm not sure I'd go that far. I think it's just, it's poor board management.
Well, and again, before we get into your conversation today about your article in Forbes, let's just address that one step further. It's interesting when, as you know, I get in front of a lot of CEOs across the country and talking about cost of healthcare and employee health. And I love to ask the question, why in the world are you willing to spend so much money on healthcare? It's often your second largest cost of doing business. What do you want? You're the customer of the healthcare system. You're the ones buying it. You're the one paying for the service. What do you want? And it's amazing how the first answer is always to attract and retain good employees. I want a benefit package that's going to attract good employees to come to work for me and stay with me. But the second thing they always say is, I want a healthy, productive workforce.
Sure.
And I love to ask the question. I say, okay, it's your second largest cost of doing business. You say you want it. Tell me what the dashboard is that you're using to monitor whether or not this spend, second largest cost of doing business, is giving you the two things you want. Are you able to attract and retain good employees? And what's the dashboard that's showing whether or not your health and well-being is improving? And they look at me like, I have a dashboard for every other part of my company, but I don't have a dashboard for those two things. And it's like, well, there's a missing void in the industry. And if the board got to see those dashboards and they were monitoring the health and well-being of the workforce, they would hold the CEO more accountable. It's the lack of measurement and the lack of a dashboard and monitoring that often it results in the fact that nobody's focusing on such a significantly important aspect.
Right. And I'm going to say something that I think will surprise a lot of people, but you know, in the various dashboards, of course, you follow what your health insurance costs are. Whether you're self-insured or whether you're conventionally insured, it's important. That is not the measure I would recommend that you use to determine the success or failure of your well-being initiative, because there are too many things going on in healthcare coverage for it to be a good measure. Do I think over time you could reduce your healthcare coverage costs if you really do a good job? Of course I do. But to use that as your measure is a fool's game. There are just too many variables. You cannot prove a direct causal relationship between a well-being action in 2017 and a claim that did not occur today. So while it is something that you look at and that you follow, that cannot be the sole reason for adopting employee well-being. Number one, it sends the wrong message to employees. It's all about your bottom line costs. There are better measures, and the measures that you should use, and Daryl, you talked about that, are turnover first. There's nothing more important than the attraction and retention of your talent, whether it's basic workers or your top flight workers, and turnover guts any organization. There is a direct causal relationship between well-being and engagement and lack of turnover. The second is, of course, employee engagement. Gallup suggests that about a third of American employees are truly engaged in their work. It is this year at an all-time high at 35%. Whoopee. That means that two-thirds of your employees are not truly engaged. And if you can increase that by 50%, imagine what that would do for your bottom line. And the third, of course, is customer service. And you might also talk about service quality and product quality. These are the things that grow the top of the line revenue. And if you focus there as opposed to just cost cutting, which is what health insurance costs are, then you're really going to be focused on the right thing. Why do I think employees don't do this? I think they think it's an HR function. I think they get distracted by the crisis of the day and this, that, and they're out in the public, and this seems a little in the weeds to them. It's not in the weeds. There's nothing more important. And I try to bring that message to CEOs, and I've had so many, Daryl, I've had so many CEOs tell me, Jim, I know what you're telling me. I don't have the time.
And yet, if they would make it one of their top 3 strategic objectives, like you often say, they would have the time because it would be top of priority.
And they would enjoy their jobs better. They could go around to a more engaged, more productive workforce. And maybe rather than spending their time looking outward all the time, if they spent their time looking inward, and especially walked around and talked to the employees, nothing better. And speaking from the standpoint of having been a CEO of a 1,000+ organization, there is nothing more rewarding for you as a CEO to just walk around and talk to the employees. They love it. You spend a little time with them and you learn the darndest things.
That's true. I couldn't agree with you more. So Jim, let's talk a little bit about the article you wrote for Forbes called COVID-19 Health Insurance and Employee Wellbeing. I've got some questions for you, but just give us the background. Why did you feel like, and you're in a great spot, probably one of the best people in the country to be able to bring that article to the forefront, but what prompted you to write that article?
I saw this article that was all about covered California, and it was suggesting that even 2020 increases in health insurance could be as much as 20%. Now they said the range was 2 to 20%. I mean, what does that tell you? But it doesn't tell you much. But nobody focuses on the 2%. They focus on the 20%. And then they said for 2021, the increases as a result of COVID-19 could be as much as 40%. And I thought to myself for a moment, I said, my God, that can't be right. Now, why are they saying this? Now, of course, they're lobbying Congress. I know, I'm guessing, I don't know, I don't have an insight, but there's a lot of money running around, and maybe some of it can go to health insurers, and maybe they figure, goodness, maybe, you know, we can come up for some of that money too. But, you know, thinking that as a result of COVID-19, rate increases could be anywhere like 20 to 40% makes no sense at all to me. So I thought before, now I know a lot about rate making. I spent a lot of years representing my Blue Cross plan as their outside counsel in rate cases, and I worked with actuaries. I know what goes into rates, but I've been out of that game for a little while. So I consulted with a couple of actuaries, and they completely confirmed what I thought, which was there are so many of the truly expensive things that are going on that are not being done, the elective surgeries, the office visits, a variety of things. And even if there are virtual office visits, they're probably being reimbursed at less. And, you know, the knees, the hip replacements, this sort of thing. And you could start to see hospitals are losing billions of dollars. And there's a reason for that. They're not getting the revenue that they expected. So I thought this just can't be so. And when we looked actuarially at it, it just can't be. Plus, without getting into the weeds too much with regard to rating, we are hoping COVID-19 is a one-time experience. We understand there may be other COVIDs, there may be other epidemics, but this, from an actuarial and rate making standpoint, is a one-time event. And when you rate people, yeah, you normalize for one-time event. What that means is you take out of the base year claims expense anything that you do not expect to be repeated in the rate year. That to some extent should be done for COVID, but you've got an equal opposite thing too. There is an enormous reduction in claims expense because of COVID. Do you take that out too? I suggest you leave both of them in. The reduction in claims expense because of COVID, because of people failing to do various things and getting elective surgeries, et cetera, is going to outweigh the additional claims expense for COVID, and the rates are going to go down anyway. I think the biggest issue with insurers is going to be the reduced premium, the reduced income that they receive because of businesses going out of business, because they got to continue their coverage, because of businesses being unable to pay. And insurers do try to work with businesses to work through this. You know, they're not the evil empire that you might think they are. At least that's my view, and I'm prejudiced a little bit. But their biggest hit, I suspect, is going to be on the revenue side. But if you can remember, it hasn't been so much in the news recently, but for many years, insurers were excoriated for the level of their reserves. And this is exactly what reserves are there for. Reserves are there to cushion against unforeseen huge swings in claims expense, and this is exactly that. So quite frankly, to the extent that because of the loss of revenue, insurers take a hit, this is the time when they ought to eat into their reserves and then slowly build them back up over time. So bottom line, you should not be seeing huge rate increases. In fact, I would suggest they may be reductions.
Well, let's talk a little bit about, you know, group health insurance has not been around for 100 years. And it's been 100 years since we had a pandemic like this. I think group health insurance really started up in the 1940s, if I remember right. And so this may be the first time the group health insurance industry has really faced something of this magnitude as a one-time unusual event. And
Yes.
like you said, I'm guessing, and maybe you could share in your discussions with the actuaries, how much of this is kind of creating a bit of a blip and a stir and a unknown, and what do we do going forward? Because it's not something that you can predict. You know, it may happen every 100 years, but how much of your conversations with the actuaries have been, we're not sure what's going on?
They'd never admit that. But
Okay.
you know, the actuaries deal with the numbers, and then there are, you know, the predictions. And of course, we don't know what the future holds. But bottom line is, this is not just for subscribers. It is equally important for your primary care physician to know that no matter how bad it gets, the insurer is going to pay the claims. So this isn't just about protecting subscribers in the event of huge swings. It's about protecting the system and making sure that Blue Cross of Rhode Island can pay all the hospitals and all the doctors, no matter how bad it gets, because they've got the reserves that can support that. And then, for heaven's sakes, when times get better, allow them to rebuild the reserves, because there will be something in the future. We don't know what the future holds. That's why it's a risk, and that's why you have reserves. I don't think it should be built into rates other than as a factor for additional contribution to reserve over time. You're talking typically an additional 1 to 2% in rates to rebuild reserves over time. That's what I think will happen.
Okay. So you've addressed a good part of the first part of your article. After addressing the issue of you don't think that rates will go up, which I think is wonderful news, and a lot of people are very concerned. I would think that that's a huge question on the part of employers, is what is my renewal going to look like in the fall? You address the need for an attention to the well-being, and I love the fact that you brought that in. You want to talk a little bit about how pushing off insurance increases, if for some reason they choose to do that, or the fact that they have over the last few years, a lot of premium increases have been shifted to employees rather than the employer, and the impact that those increases have on employees, on productivity, on the company. Talk a little bit about that. I loved what you said in the article.
Employers, of course, are in a tough spot, and now they're in a tougher spot. And let's talk about what it was before COVID and after. Before COVID, employers, for a variety of reasons, were pushing more and more costs onto the employees. And although, and I'll use rough terms, over the last 10 years, lower paid employees perhaps saw increases in compensation at 20%. They saw increases in the cost that they pay out of their pocket for health insurance go up 80%. And employees also have seen retirement plans gutted. Most defined benefit pension plans have been replaced with 401ks. And if the lower paid employees don't have the money to contribute to the 401ks, what are they getting? So they're under enormous pressure. Dollar for dollar, I think there is no question that really good health insurance coverage is valued by employees the best. And this is all about the dollars. You know, I believe that employees would appreciate employers spending more money on their coverage than increasing their salaries. It is a fundamental family security issue. I know with regard to my own Blue Cross plan, we used to pay 100% of family coverage, and we got criticized for that. And I kept arguing, we do not pay them salaries that are comparable to for-profits, but this is something that's fundamental. We are in the health insurance business, and the employees love it, and it's a great retention. tool and attraction tool. You would be amazed if you really asked HR people, what's one of the best questions that the people that want to come to, lower paid people that want to work at your company and stay with your company, want to know? What's the health insurance coverage? And when they learn it's really good, they love it. I think the tendency on the part of boards of directors to force CEOs and HR people to increase employee shares is short-sighted at best. There are better ways to save money. My message, particularly in these times after COVID-19, is for God's sakes, don't further this thing. Large deductibles, I think I understand you want employees to be thinking about where they get their coverage, think about how they spend their money. That was that whole consumer directed thing. It hasn't worked. All it's done is it's increased the pain on employees, and they forego the things that aren't emergencies. They forego the stitch in time saves 9 office visits, and I think it ultimately worsens chronic illness. I think I understand employee shares, but I think the whole idea of large deductibles is a bad one. I think if employers could do anything and spend their money in a good place right now, they would reduce their deductibles, not increase them.
Sounds good. So let's go into a little bit more about the institute that you created, the Wellbeing Institute. Thanks for addressing the article. What are some of the different strategies that Returns on Wellbeing Institute is using to get this word out of employers investing in the well-being of their employees?
We've been writing.
What are some of the things you're doing?
What we're trying to get employers to understand is the first step of the process. If you really want to take this seriously, before you do anything, you have to do an assessment of your employees to understand truly what's going on. There are employers who may have done various surveys of their employees over time, but this survey has to look at 2 fundamental things. One of which is a survey about your culture, whether this is a culture that supports employee well-being, and the other thing is about employee health and well-being itself. I believe there are 3 fundamental things. Gallup would tell you that there are 5 measures of well-being, and I agree with that. But in the workplace, I typically focus on 3: physical well-being, mental, emotional well-being, and financial well-being. I think the 3 of those are the most able to be addressed within the workplace, and I think they're fundamental drivers of the other. So you want to know for your employees, and particularly for the lower 40% paid employees, what's going on from a cultural standpoint. How supportive is the culture of the organization of their well-being and health? And then secondly, how is their physical, mental, emotional, and financial well-being? And once you get that information, you've got a blueprint that you then can use to build a strategic plan for employee well-being that addresses your culture and then addresses the physical, mental, emotional, and financial well-being of employees. If we can get employers to understand that, then they're going a long way. We talked at the beginning of the talk about the fact that so much employer, workplace wellness programs have failed. In the fundamental reasons, you can probably guess it by now, but the approaches have not been comprehensive. They've not been whole person well-being. They've not been strategic. They've not been planned, funded, staffed, executed, and held accountable as a mission critical strategic priority ought to be. They're not culturally based. Managers are not brought into the fold, and it's not CEO led. And these are the reasons why they have not failed. And each one of those things are very, very important, but the culture and the CEO leadership, I think, are critically important. So we're trying to get the word out. We're trying to reach CEOs. And of course, how many CEOs go to listen to speeches, and how many CEOs will listen to my podcasts. If I can empower CHROs, chief HR officers, or people that run well-being programs, to give them the tools that they can bring to their CEO and convince them this is something that really has to be done, I think that's probably the way to do it. So that's what we're trying to do. We're putting together a new packet on our website with data that anybody can drop down, can print and use free of charge. We've also got a well-being assessment that can be used free of charge that you can look at, fill in the information for your organization, and you get a pre-done score and an opportunity to talk to me if you'd like afterwards about how you've done. So there are some things you can do going on the returnsofwellbeing.com website to look at those. We're working with other people, and people have been remarkably supportive, helping me in this. I didn't grow up in a well-being arena, and I'm 5 years into this full time, and people have been helping me and encouraging me. So it's really been professionally very satisfying so far.
Well, Jim, I loved what you said about the assessment and how if you're going to put together a well-being strategy, you've got to assess where are the needs, and it can't just be physical. It's got to be the other dimensions. I love the fact that it's, it's not just physical, it's
Right.
social, emotional. I mean, there's so many aspects of well-being, and the idea of assessing. Let's talk a little bit about, because I have some of my own opinion. We'll talk a little bit about the well-being tracker that we're rolling out and offering it free, because I think it's so important that you monitor those well-being on a regular basis. What would be the ideal frequency that you would be able to measure and monitor each of the different aspects of well-being within a population? What would be kind of the ideal? How often would you want to know where your employees were?
It would certainly not be more than twice a year. You don't want to drive them crazy. It would be, I would probably do it either twice a year or once every 9 months. I know that sounds a little funky, but it gets you to where you need to go. You need to get a baseline, and you need to see where you're going with it. And, Daryl, you and I have talked, and I have enormous respect for what you do through Orion, and what attracted me to your organization was the fact that you really do focus on the mental and emotional equation. And, the little story that I tell, I can't remember if I told it to you, but if you were starting a well-being program for your employees, why would you start with weight loss and smoking cessation? Right now, your obese and smoking workers may be your most productive workers. They may not be adding to your claims expense now. In 30 years, they will. Hold that thought. But, the chances of them quitting smoking or losing weight and keeping it off long-term is pretty small. Why wouldn't you start instead with stress and depression? Those two items are impacting the productivity of workers right now. They're adding to your claims expense right now, and stress and depression are probably the reasons why they can't lose weight or quit smoking. We've got things backwards, but the healthcare industry over years has defined good health as an absence of illness or injury, not the presence of positive states and moods and emotions. And I think, while I guess I get that, it's not surprising the wellness industry went down that path and focused on the physical. Today, most wellness organizations at least give really good lip service to the importance of mental and emotional well-being and financial well-being. We have a long way to go, though.
Well, and I'm going to share with you a little bit about what we're doing with this well-being tracker.
I'd like to hear that.
I can't agree with you more about the fact that if you were to send out an assessment to all of your employees that, they've got to answer 50, 60 questions, doing that more than once or twice a year is going to totally disrupt your workforce. They're not going to like that. Mm-hmm. However, I'm a big fan of emotional well-being. And if all you do to address depression and stress and anxiety is here's a number. If you get sick, if you need us, here we are, call us. To me, that's not being proactive. That is waiting till someone gets so bad that they'll actually pick up the phone and call. Well,
That's your old school EAP. Yep.
Exactly. And it's, the statistics show that it takes 10 years for a person, once they start experiencing mental illness symptoms, before they are willing to reach out. And 57% of the people who are experiencing higher severe mental illness never do reach out. They never go out. And so the idea of this well-being tracker that I was just sharing a little bit about is now it's kind of like a Fitbit for well-being. Imagine if you could track emotional and social and environmental well-being like you could a Fitbit by just simply tracking steps. Well, that's not going to be very easy. But if it was a very simple way for someone to respond on a text message as to how they were doing in each of those different areas you talked about, very easily, like regularly on a maybe once, twice a month basis, to where they could say, here's where I am. And the wellness company was actually monitoring those results. Imagine what you could do as a wellness company to reach out to those people proactively and say, hey, I noticed that in the area of emotional well-being, you went from a 5 to a 3. Do you have some time? Let's discuss that. Let's talk about it. And let's then proactively get those people into the help that they need. So I would agree, filling out a survey more than once or twice a year would be crazy. But asking people to answer a quick little text message or two to be able to monitor where people are starting to fluctuate in their depression or anxiety or stress is a great way to proactively find those people early and keep them from going down the funnel and becoming more severe later down the road.
And if you, as the well-being company for a large employer, start to see trends, you can call up and say, you got a problem here and something's going
exactly.
on.
Well, and our idea is you literally put that dashboard. The employer can't see individuals because then that would be breaking HIPAA.
Right, exactly.
But why not share with not only the employer, but let the employer share with all the employees how each of those levels of well-being are doing on an ongoing basis, so that the whole, it's a peer support. It's like, look, we're not doing well as a group. What can we do to gather together to address the fact that our emotional well-being monitor is heading downward? And I'm guessing that right now with this pandemic, most people are.
and I think most people understand this, but it bears repeating. Anything, a well-being company like Orion finds out about individuals should not be relayed to the employer. But overall de-identified data that show trends, absolutely. And this is a huge management tool that is terribly underused.
Well, let's talk about culture, because I know culture, you talked about that already, but what better for an employer to address culture aspects of their company than to have a monitor that the employees are populating, sharing with the employer where the problems are. And if an employer wants to correct the culture within the company, let's gather data to find out where the need is. Is there a department within the company where culture, maybe based on the managers or supervisor of that department, is just really struggling? Well, let's share that with the employer so that those can be focused on and addressed. Because culture can vary within the company greatly.
Yeah, and of course, okay, what drives culture change? From the CEO down, it's got to be made really wicked important that managers understand the importance of this and are held accountable for it. We interviewed the chief well-being officer of SAP. It's a German organization, and they, they have something like 80,000 employees, and they each year do an assessment of their employees, and it is the single most important thing that the CEO and the board of directors looks at, and they calculated, and I may have the number wrong, I didn't look this up ahead of time, so forgive me if I have it wrong, but a 1% reduction in the well-being index of their employees equated to like 20 million euros. They are really focused on this. And to the extent that you find ways to hold managers and other leaders of an organization directly accountable for the health and well-being of their employees, and I understand it's tricky, but you've got to have an accountability for this. And there are ways to measure it if you want to do it. But to the extent that you can make this clearly an accountability, they start to get it, and they understand there is another way to hit their numbers other than just wrecking employees.
Well, and I'll share with you another example. So I met the recently retired medical director of Prudential Financial, and he shared with me a story. His name is Andy Crichton, Dr. Crichton, and he about 10 or 12 years ago at Prudential decided that what if this whole idea of employer-sponsored health insurance were to go away? And let's say the government were to step in and take over.
Right.
Would we care, and what would we care about? And he decided that, yeah, we would care. We would care a lot about the productivity and the health of our workforce. So over the last 10 or 12 years, Prudential has regularly sent out assessments and surveys to measure each of the different areas of well-being, so that as a company, I mean, they did exactly what we're talking about. They measured it, they monitored it, and then they implemented strategies to affect those indexes, those well-being dashboards that they were using to say, how are we doing culturally within the company? And how can we affect this to create a more healthy, productive workforce? Another great shout out to them.
Yep. I talk with people in Europe. Of course, Europe doesn't have employer-sponsored health insurance, and yet they have strong well-being programs. Why?
Yeah.
Earlier in this program, I mentioned, do not measure the success of your program based upon increases or decreases in health insurance coverage costs. There are more important things to focus on, more strategic things. Again, turnover, engagement, customer service. The returns from those, to the extent you can increase them, will absolutely dwarf any reduction you are ever going to get in health insurance coverage costs. So this is about something fundamentally more than about the physical health of employees and how often they go to the doctors and hospitals. I couldn't agree with you more, Daryl.
I'm gonna just reach out to those that are attending and listening in today and see if, we've mentioned a few examples, see if anybody out there has some examples they would like to share, or if anyone has any questions. I've got a couple more questions, but I'd love to see if the attendees have any questions for you, Jim. So just kind of put that out there and see if anybody has any. Let's go back while we're seeing if anybody else has any questions and ask someone from an insurance standpoint. You've run an insurance company. You hear in the industry the question of, do insurance companies, what's the alignment like between the employer who's buying healthcare and the insurance company? Some say that as the insurance company's costs go up, their shareholders' profit goes up. And if the costs were to go down, the shareholders' profit goes down. And thus there's not an alignment between what the insurance company, if it's for profit, what they're really trying to accomplish, and the employer that's buying it. Talk a little bit about, you've been in the weeds of an insurance company. Is there an alignment, or is there not an alignment, or is there a need for greater alignment?
I do think there's an alignment, but of course there is huge variability amongst insurers. There are nonprofit insurers and there are for-profit insurers. For-profit insurers, of course, have to end up looking at shareholder value and dividends, and a nonprofit basically looks at its reserve. It used to be that insurers would charge an administrative fee based on a percentage of claims. And if they continue to do that today, what you say is absolutely correct. It would mean that to the extent that there are more claims and the rates go up, the percentage for your administrative expense goes up too. Of course, that makes no sense. These days, with the competition amongst insurers, there are essentially two components of rates. There's a claims expense, and then there is the administrative charge. And the for-profits and nonprofits compete terribly on the administrative charge. And basically now most of it is on a per member per month basis, and it bears no relationship to the claims expense. And I know that sounds a little in the weeds, but basically what I'm saying is as claims go up, that won't affect that. Now, there is one sticky wicket in the weeds. When the ACA was enacted, Obamacare, it created a situation where it basically said that if insurers had administrative expenses in excess of 15% of claims, they would have to return some of that money to the ratepayers. Honestly, I thought this was one of the stupidest parts of the ACA because, you know, for example, let's take a small insurer like Blue Cross Rhode Island. What differentiates us? It is our customer service, it's our outreach. We have no economies of scale to speak of. We had 600,000, 700,000 members. Of course, our administrative expenses are going to be a larger percentage of claims than United Healthcare. It stands to reason.
Right.
Do you want to penalize us because we spend more money on our call centers and people helping people out? Now, it gets tricky in terms of what's a claims expense and what's an operating expense, and I don't want to get into that, but there is some evidence to suggest that to the extent that claims expense increases, it gives some insurers, and particularly for-profit insurers, more room on that 15 or 12%. Do I know it's happened? That was beyond my time. I had left, so I could not tell you, as a matter of fact, one way or the other. I
couldn't agree with you more, Jim.
I'm not that cynical,
Right.
but you know, nobody wants to go to the prom with a health insurer, so you suspect a lot of them, and I suspect they're a little better than you give them credit for.
Well, and I couldn't agree with you more that idea of the 15% that was a part of the Affordable Care Act, it was intended to do the right thing, but I think it had the potential of doing just the opposite. Mm-hmm. It created an environment that squoze the carriers into, you know, how do they make more profit and reduce claims? It put them in a really difficult balanced position.
It would require somebody like Rhode Island to decide we've got to cut our operating expense. Now, normally it's yeah, tough stuff, you know, but do you really want us to do that? I mean, everybody assumes that health insurers are bloated and inefficient because they compare our operating expense with, you know, Medicare, but that's silly. Medicare has got scale to die for, and they don't do much. So the fact that their administrative expenses are south of 5% isn't very surprising. The whole idea of a local nonprofit insurer is to be more connected with their community and give better service and to be more in touch. And you know, one of the reasons why the Medicare Advantage program has been so successful is because local insurers do a heck of a lot of managed care. I know that there are some providers that don't like that term, but it's important if done right. And that's why the Medicare Advantage program continues to be a success. That is the private insured Medicare program that is not traditional Medicare.
Right, right. So Jim, we're coming close to an hour, so I'd like to wrap things up. But before I do, I want to give you a few minutes to share anything that you had wanted to share that you haven't had a chance to talk about, whether it's the Institute, whether it's the article you wrote or other articles you plan to write. What are some last minute thoughts you've got for our attendees?
I don't particularly want to talk about me or us. You and I had a brief discussion before we started about resilience. And you know, if those of you who are listening out there, the importance of resilience, even pre-COVID-19, much less post, has never been more important. We can make a lot of fun of millennials and call them precious little snowflakes, but their stress levels are real. We've got to deal with it, and we've got to find a way of building the resilience that I truly believe is within each of us. A friend of mine, Richard Citron, wrote the book, The Resilience Advantage, and he talks about the whole idea of resilience is not bouncing back, but it's bouncing forward. It is taking an adverse circumstance and not just recovering from it, but learning from it and becoming better as a result of it. And it's a mindset to do this. And how do you do this? And how do you get peer support to build resiliency amongst employees or even families? I think these days, I cannot think of a subject more important than resilience. And I recommend it to any of you listening to learn more about it, to read about it, to think not just, if you are in charge of employees, but even in your personal lives and how you raise your kids, what you do. If you've got a 1-year-old who's learning how to walk and he or she falls, smile. Don't go, oh, you send a different message. It's just, well, but I'm a boomer. What can I say? I think that's the message I'd like to leave you with.
Well, and I think it's a great message. And because of the importance of resilience, for those that have been watching many of these huddles, we've actually addressed that numerous times because it's such a critical thing right now during this pandemic, the way we exercise resilience and learn how to support each other. I loved what you said earlier about the fact that resilience is not an isolated individual event. You shared some experiences before we came on about being in the military and how critical that ability as a group of a platoon or a troop or a military group, their resilience and the support they give each other to be resilient is critical. Do you want to just share any last minute words about your experience in the Army and resilience?
Yeah, many years ago, I was in 101st Airborne Division Pathfinder team in Vietnam. We had a small, tightly knit group, and we were very much in harm's way. And we had various little things that we did after really bad things happened that got us together and made us stronger. And it was all about us, whether we put our arms around each other or whether we just said silly things and laughed or cried. The importance of group support, whether it's a family or a workplace, cannot be overstated. I know from a military perspective, it has been proven out. You've got these kids going over to the Middle East, 2-3 tours. I can't even imagine that. And yet their resilience has been enormous. And it is because the military has learned the importance of the squad and platoon and company need to take care of one another and support one another. I think the military has been remarkable in terms of what it's done from a resilience standpoint. I know it's, there are high suicide rates. I understand that, but still, given what these young men and women have gone through, I think their resilience has been enormous.
Amen. I couldn't agree with you more. Well, Jim, thank you so much. Let's conclude now and kind of wrap things up. I want to mention that our guest panelist this Wednesday is going to be, so May 20th will be Dakota Driscoll. Dakota will be sharing thoughts about mental health and well-being from a cosmetology standpoint. When we finish the huddle today, you'll all be receiving a survey. We'd encourage you to take that survey so we can get your feedback. If you've got suggestions on topics for upcoming huddles, please share those with us. Or if you've got guest panelists that you would think might be a good guest panelists for the Going on Offense huddles, please share those with us. You can communicate with us through the Contact Us form on the Going on Offense website, goingonoffense.com. I want to thank the organizations that have gotten behind this. There are a number of tremendous offerings for employers or individuals. There's lots of ideas, suggestions, and resources on that Going on Offense website. Please take advantage of those. And we are recording the huddle today, so we'll be posting that later today on our website. I want to sign off now, but again, Jim, thank you so much. So appreciate your being on today and your insights, especially within the insurance and the whole well-being area. Again, to our audience, we hold these every Monday, Wednesday, and Friday. Please join us for an upcoming huddle, and we'll sign off and say goodnight.